I wish you could have been in Boston at the World Series time. It was really intense. Out to dinner with friends, waiting online for coffee, waiting for a taxi, meeting a neighbor. Didn't matter where you were, didn't matter if it was a stranger, you talked about the Red Sox. Our fingers were crossed and everybody had their advice ready just in case the Red Sox manager happened to call them to ask if they should start Derek Lowe or not. We didn't dare hope, but we couldn't stop hoping. All that intensity about baseball, about a game. I want that in our work, the work of making care better, the relief of suffering. Is it impossible? It's impossible to imagine that we'd wake up in the morning and rush to the papers to see the box score on our game, the one we're playing, not the one we're watching. I'm losing my patience. Maybe it's my age, maybe it's my emails, maybe it's people who keep telling me what's wrong with their care. Maybe it's the word of Honor Page, who spoke at our forum last year, the mother of Annie Page, who has cystic fibrosis. When I asked her what she most wanted healthcare to hear, Honor said to me, "Tell them the clock is ticking for Annie." Or maybe it's the hope that I find in your work, in the work that so many of you in this room are doing every single day to improve care. You're doing so much, so well. You're putting the actual transformation within the reach, and now we need to grab it. And I'm losing my patience. So here's what I think we should do. I think we should save 100,000 lives. I think we should do that by June 14th, 2006, 18 months from now. Some is not a number, soon is not a time. Here's the number, 100,000. And here's the time, June 14th, 2006, 9 a.m. The Red Sox did their job. Now, let's do our job. Now, let's do our job. I think the time for discipline has come. Time for getting the job done. And this is going to be at 100,000 lives, June 14th, 2006. We're going to do it with a campaign, a world-class campaign. We're going to elect quality.